Hi, my name is Dr. Paul. Is it all in your head? Well, it was in mine. It really was. I was hit by a bullet when I was 18 years old, and right there. And with my history of allergies, it extenuated and aggravated and flared it up. I was on certain days getting runny noses all day. I was getting severe itchy eyes, and to the point where with my eyes would be so inflamed on the next day after rubbing them so hard. I was really frustrated with my allergies. Not only that, I've had energy issues, loss of hair, spots on my back. And one of the first things that I learned was learning to decrease the reaction of the allergies on my nose by treating my head. So I would find pressure points on my head using a particular technique called matrix repatterning, and that's how I started my journey in doing head work. So in this particular case, it was in my head. And I've seen patients that have had issues with sinuses that would clear up after one treatment because their head was so restricted or tight. Anything that's not moving is not good. And so when the head, which is made up of several bones, is not moving, it doesn't move like this. Obviously, it's a joint. These are small, tiny little joints on the head, and they have slight motion. But I can detect with my fingers where the pressure points are, where the tightness is in the head. Adjust those points with just either putting pressure on here or doing a small thing called a drop technique, which basically you could see when I work on you here at the office. But it's a mild, sudden release of motion, and it's called a drop. It basically, the table just drops quickly, and it brings speed into the adjustment, but it's very gentle. So it feels gentle, and obviously you're not going to be able to perform a chiropractic adjustment like a regular pop adjustment on the spine because the head doesn't make a pop. So all that to say that it gave me great relief of being able to treat my own head and solving so many different issues, not only allergy treatments, but eye symptoms, blurry vision, dizziness, vertigo. Uh, I've had patients that I treated had problems for pressure points, headaches, obviously, migraines. So whatever the symptom is, if there is an issue with the head, like from a prior injury, a prior fall, concussions, it could be all the way from birth or even birth injuries, forceps during the birth process, even cesarean surgery where the head doesn't have the opportunity to go out the vaginal canal, gets stuck because it doesn't start the breathing motion of the skull bones because it didn't have to go through the vaginal canal where the head collapses. That's why you have that little fontanelle on the top to collapse so that the head can go out. And then when the head comes out, it comes out and it expands, and that begins the cranial motion and breathing and flow of the cranial fluid called the cerebrospinal fluid. So basically, I treated my head after this head injury that I had at 18 from a bullet, and I first find out that I could actually give myself relief, and that began my journey over many years ago, 10 to 15 years. So now I always check a patient with any prior head injuries, and even if they sometimes forget that they had head injuries, and when I start working on the head, they go, "Oh yeah, I had that head injury," because yeah, that's good. We forget our head injuries, but it's important to treat it for any kids, whether it be autism, especially with sport injuries, very common in football. If you see the movie Concussion, that whole movie was based on the NFL and how these former NFL athletes would sometimes actually die from these multiple contusions to the head. You can see this with boxing and any type of injuries, even if you're not into sports. So the first thing I would do is check and I can check with my hands what's tight over the head, and I would gently massage it and gently. It's got to be on the exact points on multiple different points of the head. At the same time, I will put pressure on those points wherever it's tight, and oftentimes the patient, they want to sleep, they feel relaxed, they feel very light after the treatment. It's very gentle, relaxing treatment. And if you want to get that checked, you can come to my office and you can visit drquick.com to get more information on what I do here. It's been a pleasure to visit with you, and I hope you get to see all my other videos.